A snake strikes your ankle, then vanishes before anyone can identify it. There is no hospital, no laboratory, and no antivenom waiting beyond the trees. Yet death is not certain, because the first mystery is already inside the bite. Did the snake inject a lethal dose, a small dose, or no venom at all? That answer, plus immediate stillness and determined group care, could decide whether you survived the night. Venomous snakes do not bite humans because they see us as ordinary prey. Most defensive strikes happen when a hidden snake feels stepped on, trapped, cornered, or suddenly grabbed by a hand. Even then, fangs entering skin does not guarantee that much venom entered with them. Modern studies document dry bites, where a venomous snake injects little or no venom despite leaving clear fang marks. Rates vary enormously, so no frightened person could safely assume that lucky outcome. The dry bites explain why some ancient treatments may have looked more powerful than they were. If the victim recovered after a leaf paste, everyone remembered the leaves, not the missing venom. When venom did enter, the next problem depended entirely on the snake. Some toxins disrupt nerves until eyelids fall and breathing muscles stop obeying. Others damage blood vessels and clotting, causing uncontrolled bleeding deep inside the body. Some destroy tissue around the bite, swelling a foot until skin and muscle begin dying. The dose mattered too, along with bite depth, body size, health, bite location, and the victim's distance from camp. There was never one prehistoric snakebite with one predictable countdown. That made prevention far more valuable than any desperate cure attempted afterward. Humans and other primates seem unusually prepared to notice the curves and scales of snakes. Experiments find selective responses even in infants or monkeys without much snake experience. That does not mean every ancestor possessed a magical detector hidden in the brain. Attention still needed training from elders who knew where snakes rested, hunted, and escaped. A careful forager could probe dense grass with a stick, avoid blind handholds, and watch sun-warmed rocks before reaching down. People could clear sleeping ground, inspect bundles, and keep food scraps from attracting rodents and the snakes hunting them. Firelight, raised bedding, and foot coverings added imperfect barriers during the riskiest moments. Still, one missed coal could turn all that knowledge into an emergency. The victim's first instinct would be terrible: panic, run, and chase help. Muscle movement can help carry venom away from the bite through lymphatic flow. The better move was brutally simple: stop the victim from walking. Companions could support the bitten limb, build a quick litter from poles and hide, and carry the person toward shelter. They did not need to understand lymph vessels to notice that struggling patients worsened. But stillness is not the same as tying a narrow cord until circulation disappears. Tight tourniquets can starve tissue, trap destructive toxins, and create another severe injury. Cutting fang marks adds bleeding and infection without reliably removing venom already spreading. Sucking, burning, or packing the wound with harsh substances can waste time and damage skin. Ancient people surely tried many such actions because frightened humans urgently need to act when an invisible poison seems to spread. Some remedies may have cooled pain, reduced rubbing, or protected an open wound. That is very different from neutralizing a complex mixture of toxins throughout the body. Modern antivenom uses antibodies matched to particular venoms. Even that match can be difficult. No known prehistoric plant preparation worked like a universal antibody treatment. So after stillness, survival depended on what the victim's own body could endure. This is where companions became more important than any object placed on the bite. A weak victim needed shade in heat, warmth in cold, water when safely swallowed, and constant protection from predators. Vomiting or paralysis could make choking a danger, so body position and constant watching mattered. If breathing weakened, survival without assisted ventilation became far less likely. If tissue swelled, the group faced days of pain, wound care, and possible infection. Even a survivor might lose function in a hand or foot, struggle to travel, and remain dependent on others for months. That burden reveals the deeper answer hidden behind the dramatic bite itself. Ancient snakebite survival was not a duel between one person and one snake. It was a test of whether an entire group could stop, carry, feed, guard, and wait. Not every band could afford that delay, and not every victim received equal care. But sustained cooperation could preserve a life when the venom dose was biologically survivable. Recovery then taught the group which habitats, seasons, weather conditions, and careless behaviors had produced the dangerous encounter. It also created stories about treatments, including remedies that may deserve no credit. The most useful knowledge was probably less glamorous. Look carefully, step carefully, and never walk after a bite. Some ancient humans survived because the strike was dry, or the dose was small. Others survived because their venom caused damage the body could slowly repair. And some survived because companions prevented panic from turning a dangerous bite into a fatal one. There was no secret universal antidote, only luck. Learn caution, stillness, endurance, careful observation, and human care through the longest hours. Against venom, humanity's oldest advantage may not have been medicine, but refusing to leave an injured person alone when survival took many uncertain hours.